Alessandro is a PhD student of drug sciences at the University of Bari. He primarily focuses on developing functional 3D skeletal muscle organoids. And he's been spending some time with us here at Nanion to develop assays with the Patchliner instrument in order to measure NAV currents with his cells. But thank you very much, Alessandro, for being here. And we look forward today to your talk about mexiletine selectivity and the characterization of human myofiber precursors during your time with the Patchliner. Thank you very much. The floor is yours.
Thank you for the kind introduction. And first and foremost, I want to say thanks to the organizers for this great opportunity. My name is Alessandro Cerchiara. I'm a PhD candidate of University of Bari. And today we'll talk about my first time with Patchliner. Okay. It's not good. So this talk will be divided in two main parts. The first part will be about the effects of mexiletine and its pyrrolene derivative that we tested previously in our lab in condition of tonic voltage use-dependent blocks to assess tissue selectivity and benefit risk profiles. The second part will be about the characterization of the electrophysiological asset of immortalized human skeletal muscle cells. So, sodium channels' role in excitable cells is pivotal, for example, for generating the action potential. Endodystrophic myotonias are inherited rare skeletal muscle disorders caused by ion channels mutations, such as NaV1.4, that is a sodium muscle channel. Furthermore, NaV1.7 could play an important role in pain. In fact, mutations of the channel are associated to different pathologies such as erythromelalgia, and also the blockade of NaV1.5 can have serious implications for cardiac safety. Also, drugs like mexiletine, which is a class 1 antiarrhythmic drug, which have been approved in myotonia for its effect of exerting a use-dependent block of NaV1.4, so it could be also used, for example, because for other pathologies, because different authors showed that mexiletine present an analgesic effect in patients suffering from erythromelalgia. So our aim was to discriminate drug action between NaV1.4, NaV1.7, and cardiac NaV1.5 using automated patch clamp to assess cardiac toxicity risk. Since efficient and reliable preclinical tests are pivotal to find novel drugs for disease caused by ion channel mutations, automatic patch clamp could be a successful and pivotal tool for reproducible and efficient screening of drugs such as antimyotonic and analgesic agents. So, for this purpose, we use T671 cells which express NaV1.4, CHO cells expressing NaV1.5, and X cells expressing NaV1.7. Then we test mexiletine and also its pyrrolene derivative that is WM11. And for those response curves, we include at least 8 increasing concentration starting from 0.3 micromolar to 1 millimolar. Then we use the automated patch clamp platform that is Patchliner. We analyze the recording peaks at -20 millivolts in different conditions, in particular, tonic block with a holding potential of -100 millivolts, voltage-dependent block with 2 different holding potential, -70 and -140 millivolts. And then also use-dependent blocks with an holding potential of -100 millivolts, and in particular, 3 Hertz for NaV1.5 to mimic the pathophysiological heart rate, 10 Hertz for NaV1.4 to mimic the myotonic discharge, and 20 Hertz for NaV1.7. So these are, as you can see, the dose response curve. We have the concentration and the blockage, so the reduction of current. And as for the tonic block, we see that mexiletine was more potent in blocking NaV1.5 more than NaV1.4 and NaV1.7, and WM11 potently block both NaV1.4 and NaV1.5 with similar IC50 values. Then we also assess voltage-dependent block at -140 millivolts, and we see that mexiletine was more potent in producing voltage-dependent block more than NaV1.4 and NaV1.7, and WM11 blocked NaV1.4, NaV1.5, and NaV1.7 with similar IC50 values. As for the voltage-dependent block at -70 millivolts, we see that mexiletine was more potent in blocking NaV1.5, more the other two NaV isoforms, and WM11 block all sodium channel isoforms with similar IC50. Lastly, we also assess use-dependent block, and in particular, we see that at 10 and 20 Hz, mexiletine and WM11 potently blocked NaV1.4 and NaV1.7 respectively, and we see also that WM11 produces a similar block for all channels. So just to sum up this first part, we see that as for NaV1.4 results, potency of mexiletine increased about threefold of use-dependent block, and WM11 was more potent than mexiletine in both tonic and use-dependent blocks. As for NaV1.5, we see that mexiletine had a similar potency in tonic and use-dependent block, but was tenfold more potent at -70 millivolts. And WM11 was more potent than mexiletine in both tonic and use-dependent block. Lastly, as for the NaV1.7 data, we see that mexiletine produced almost sevenfold more potent use-dependent block, as you can see here in the table below, compared to the tonic block. As for WM11, it was fourfold more potent in producing use-dependent block compared to tonic block, and was more potent than mexiletine. So now let's start with the second part, so with the electrophysiological asset of skeletal muscle cells. Since ion channels plays an important role in skeletal muscle, and different muscle-related diseases are associated to altered or mutated ion channels, such as NaV1.4 for paramyotonia congenita, further understanding the electrophysiological asset of muscle cells could be pivotal to unravel the pathophysiological mechanism of muscle-related disease. Also, patching skeletal muscle cells, especially in differentiation due to the high membrane capacitance of myotubes, could be difficult and time-consuming using the manual rig. So our aim was to assess the electrophysiological asset of skeletal muscle cells using automated patch clamp, and we use immortalized muscle-derived cells from healthy donors in proliferation on your left and in differentiation. So about the methods, we cultured the skeletal muscle cells in proliferation, thus obtaining myoblasts. There are myoblasts in proliferation. And then if we started the differentiation by changing the media, we obtain myotubes that are elongated and multinucleated cells at different time points, day 4, day 7, day 12, and day 20. Then we use different detachment process for both cell types, quote-unquote types, and we see that we use we use trypsin to detach myoblast, and we use acutes to detach myotubes. Then we use automated patch clamp, and by launching IV protocol and analyzing inward currents, and also we launch other protocols to assess cell stability during recordings. From this data, we also obtain two important success rates that are the catching rate, that are the number of cells catched compared to the maximum number of cells that the Patchliner could catch in one run. And the other success rate was the recording rate. So the cell recorded until the end of the experiment compared to the cell catched by the Patchliner in that particular run. Now I will do just a brief overview of the inward currents in the skeletal muscle cell throughout differentiation. And as you can see, we obtain a good catching rate and also a good recording rate for the myoblast, so in proliferation. Then for day 4 myotubes, we obtain a good catching rate and low recording rate compared to the myoblast, but it's like 66%. And as for day 7 myotubes, we obtain a good catching rate and also good recording rate with 82% of success rate. Day 12 myotubes present a good catching rate, but a lower recording rate compared to the other time point of differentiation. Probably we need to improve this part we'll talk about later, but I mean, it's just because sometimes we lose some cells. No, we lost because it's the past. We lost some cells during the washing steps, for example, what we'll talk about later in detail. Then as for the day 20 myotubes, I just want to say that this kind of sample is rare because you need to wait 20 days in differentiation to obtain these myotubes, and we obtain a good catching rate and also a good recording rate of almost 70%. Now we want to show you the inward current density that we obtain by dividing the inward current by the membrane capacitance. And as you can see, there is, so the inward current density is increasing as the differentiation progresses. And this is consistent with other data that we recorded from the manual rig in murine wild-type skeletal muscle cells. But when we I want to show you the absolute inward current, so it's nanoampere, we see that there is no linear correlation between the increase of the inward currents and the stage of differentiation. And also, surprisingly, we see that the membrane capacitance, as expected, is not increasing with the differentiation as in the murine wild-type skeletal muscle cells, and these are data obtained with the manual rig. So we ask ourselves some questions. Probably the Patchliner was catching only the smaller cells, or probably we need to find alternative detachment process other than the enzyme acutase just to obtain more floating myotubes. And probably we need to improve the washing step, as I said before, because we were losing, after adding the seal enhancer solution, we just lose some cells after the second washing step. So probably some parameters needed to be changed. And probably, perhaps, the high concentration of calcium that is 10 millimolar in the seal enhancer solution could induce contraction in more mature myotubes. So, in conclusion, I just want to say that this experience was really something really amazing. The Patchliner commands and programs were user-friendly, and the protocols were easy to custom and set before starting the experiment. And also, the Patchliner allowed me to rapidly advance with the pharmacological characterization of mexiletine and its analog on 3 different nerve channels in a few weeks, and record ion currents. We also recorded ion currents thanks to the Patchliner for the first time from skeletal muscle myocytes up to day 20. And all this data just confirmed that Patchliner is an outstanding tool for academic research. Then there are also just some open points that we will do in our future plans. Just further experiment for pharmacologically characterize nerve channels and compare data obtained with conventional voltage and also Patchliner methods. We need to find alternative detachment process for differentiated myotubes and also change some parameters in the washing steps and assess the membrane capacitance also in the bigger myotubes. Then, before you go, I just want to say just one last warning, please. Believe me, really, because please don't use too much the machine because it can cause addiction, really. I'm just now showing you some figures that just confirming what I'm saying, because you're just working, as always. As you can see, I'm working. Yes, this is not tagging the Patchliner, no, it's just working. And then you just work a lot, and just friends are worried about you. And they say, why are you working so hard, Alessandro? Why? Because I was working too hard. And then since I was not listening to them, they are forced me to pull away from the Patchliner. So please don't do the same mistakes as I did. Joking aside, I just want to say that my visiting period was 3 months, almost 3 months, 2 months and a half. In Lanyon was really wonderful. I like Munich, I like Lanyon, I like really all of what happened during my PhD, during my visiting period. And I also just want to thank Nanyon's team, but especially Nadine, Alison, Jan, Keith and Christian that helped me out to fully understand the machine and also to figure out how amazing is this machine, really. And I just want to say that, just want to thank all Nanyon's team because I just love working with them and also having just fun with them and having a beer. And I just want also to thank all the people from University of Bari, and especially Professor De Luca, Professor Imbrici, Professor Cappellari, and Professor Del Bellis, and all the people from the pharmacological lab, because they have supported me during my PhD and also my visiting period. And I want to thank the medicinal chemistry lab team that have synthesized the compounds that I used in this experiment. And also thank you for your attention. But as you can say also here in Germany, sorry, vielen Dank für Ihre Aufmerksamkeit und grazie a voi.
Thanks a lot, Alessandro, for sharing those really wonderfully impressive results and a perfect endorsement of the Patchliner as well. Wonderful product. Thanks a lot. Do we have any questions, Alessandro, in the room? Anything online? Oh, okay.
I was crystal clear.
Yeah,
Yeah, perfect.
It was.
I was crystal clear. Yes, thank you.
I have a quick question for you about your future work using the enzyme detachment process.
Yes.
And what choices you'll use. And my experience, Accutase can be quite soft, and it's maybe not the strongest thing to use. Would you go in a more stronger direction?
I think that was depending on how strong was the enzyme, because when you use, for example, trypsin, it's stronger, so you can detach myoblasts. It's okay that are round shaped. In fact, I didn't show it, but there are similar inward currents also from the myoblast, but with the manual rig, because we recorded that, but we need to do other experiment in differentiation just to compare. But the use of Accutase was to just gently detach the cells, because we need some bigger cells, as you see also in the presentation, because the capacity was too low, and probably we need the bigger cells, because probably we need to find alternatives that are more gentle, I don't know, Accutase max or something else. So that's why we use Accutase and not trypsin.
Okay. That makes sense. Thank you very much. All right. In that case, thank you very much, Alessandro, once again. And we will move on to our next speaker for today.